Mall Studios. This is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, 25 minutes before 12 o'clock. I think I've been saying this more times than I should have, but I think the calendar has tricked us. Today should be Thanksgiving. You know that, right?
Yeah, I know.
But no, we got to wait a whole week for Thanksgiving. Here's the problem with that. Thanksgiving will come, and next thing you know, it's December. And you say, wait a minute, isn't there supposed to be a buffer period between Thanksgiving and December? Yeah. Well, there's not. And that doesn't only have to do with the holidays. It has to do with the Medicare enrollment period. Because guess what? It ends December 7th. Mm-hmm. Just so you know, if you haven't signed up for the Medicare programs that will be best for you, you got to take care of that right now.
That's
Dr.
right.
Christopher Arnold is on the phone. He's a senior medical director for WellMed, and he's going to tell us about the enrollment season and what you need to know to make sure that you don't pass that December 7th deadline and regret not doing what you needed to do. Dr. Christopher Arnold, good morning, sir. How are you?
Good morning. Thanks for having me this morning.
You're welcome. Where are you right now?
I'm in San Antonio, Texas.
All right, so the December 7th, we have to have everything done. And who are we talking to? Everybody who's 65, correct, and older?
Yeah, Medicare age patients, exactly. And it's, like you said, time of year, everybody changes their health plan, or at least reviews their health plan. But it's also, a great time to reflect and make sure you've got the right doctor. It's critical decision, someone you trust with your health and your well-being.
Now, how do you know if you don't have the right plan? I'm assuming that one way would be that you tried to get some services during the course of the year and you weren't able to get it. But what about the new person? How do they know what's the best one?
Well, a lot of different plans actually are tailored around disease, believe it or not. So if you've got diabetes or chronic respiratory illnesses or heart disease, there are actually some plans out there that offer tailored kind of benefits and copays for certain specialists, as well as medication copays that would encourage you to maintain your health and go to your doctor visits and see your cardiologist, for example, or see your diabetes specialist, that kind of thing. So there's certain plan benefits, but I think assessing that you've got the right doctor is the most important one, because that's someone you've got to trust with your, like I said, trust with your health care.
And is that what you refer to as value-based care?
Exactly. I think first, like I said, the first question would be ask if they like their doctor, and then the follow-up question would be, does their doctor practice value-based care, which is also known as outcomes-based care or preventative type of care. The old paradigm of care, you just go see your doctor only when you're sick. But this new type of preventative care, you're seeing your doctor proactively, not reactively. And so, and doctors are actually graded on how well and how successful they are in improving the health of their patients and keeping them healthy, like their diabetes, heart disease, and respiratory illness. And actually, health plans reward doctors and incentivize them to keep their patients healthy rather than just seeing a high volume of patients. They want to reward those doctors for practicing good outcomes.
Yeah, that would make sense. So would one way to know which plan would be best would be to sit with your doctor, or is it too time consuming for the doctor to talk to every patient about their Medicare plan?
Yeah, not a lot of doctors, to be honest, are quite well versed on the different plans. The best would be to talk to, a insurance broker or someone of that nature that can advise you on the different types of plans that are available that could be tailored to your disease or what your needs are. I think that'd be the best place to start, because doctors, they kind of get a little uncomfortable when you talk to them about that.
Yeah.
And we have to make sure also that the family members might be involved, because the family members might be the ones to be the caregiver or the person that transports the person that is on Medicare to their doctor's appointments.
Exactly. Yeah. No one wants to spend more time, in the hospital or when they're sick. And I think the important thing is the value-based care model includes a peace of mind to the caregiver, and that the doctor is their quarterback of care, and they're coordinating care with their specialists and other healthcare providers to help take that burden off caregivers and family members, because it can be stressful and emotional. And so WellMed, we have caregiver SOS programs that are free to caregivers so they can concentrate on being a family member and friend versus a caretaker.
What is the supplemental program? What does that mean?
What is a supplemental program?
Yeah, it says Plan B, or what is that word again? We had.
Yeah, well, you have traditional Medicare, and then you have supplements. So certain companies or certain entities have supplements that will actually cover some benefits that maybe Medicare doesn't cover. So this can sometimes cost a little bit of extra money on a monthly basis, but sometimes that will help cover the extra cost of certain medications or co-pays or procedures that a patient may have, yeah.
And for the communication to be open between the patients and their doctors, that it could help with better management of the things that are affecting them, like diabetes, for example.
Right. Care nowadays is sadly very fragmented. You may have one cardiologist writing for a prescription, and then you go see your gastroenterologist and they write for a different prescription, but they're not necessarily communicating directly with one another, and those medications may interact with one another, for example. But having a value-based care doctor or a kind of quarterback of your care, they can kind of see and manage everything that's going on with your care and assess and determine if you're going to have a drug interaction, or if you had a CAT scan or an X-ray just last week with a cardiologist, and then your kidney doctor orders another X-ray and lab work next week. That's just ridiculous. You just had it done, and so having a value-based care doctor kind of coordinate your care makes better sense for everybody.
If a husband and wife are both eligible for Medicare and they both are getting their different Plan Bs or the other part of it, does being a man or being a woman automatically help you decide which plan is best for you?
No, not necessarily gender-specific plans. Like I said, it's mostly based on disease and the type of specialists that are in their networks that you could see. So that's kind of, that's something to consider when you talk to these insurance agents or brokers about the right health plan for you, and let alone right doctor for you, is where they go, what hospitals do they use, what specialists do they use. So that's something you want to take with you. And medications, what medications are covered on. There's different tiers of medications that different plans cover, so you want to bring that with you when you talk with them to make sure you pick the right plan.
And you yourself, as a physician, also has to make sure that your staff is always on top of their game.
Yeah, absolutely. Patient experience is something at WellMed we value and emphasize, because it's just like a restaurant. You're not going to go back if you had a bad experience, whether it was waiting to be seated or you had a bad checkout experience. It's the same kind of thing in the doctor's office. If the front office staff are not communicating with the back office, or the back office is not communicating with medical records or your schedulers, it just makes for a lousy experience, and you're not going to want to go back. And like at WellMed, we focus on the prevention of illness rather than reactive treatment of disease, and I think that's what helps keep patients healthy and coming back to see us.
We're in Florida, so if somebody is here as a snowbird, they're not at their primary residence up north, but they're here, are they able to sign up for their proper Medicare plans? Obviously, the deadline ends December 7th. They're probably going to be here. Can they? They can do it here, right? They don't need to be home.
Right, they can. Yeah, there's kind of a key cutoff in all the different plan literature that you'll hear is a 6-month period. So if you're moving out of the area for 6 months or more, you're kind of skating on thin ice in terms of what's ethically appropriate. The plans are specific to those areas, and the network is unique to, say, Orlando or Tampa or Fort Myers, wherever you live, and that's critical. So if you're moving up north and you live in Canada, as long as it's not more than 6 months, I don't think anybody's going to raise any eyebrows. But yeah, that's a good question. Not a lot of people think about if they live up north.
Before we wrap it up, can you leave us with a phone number, a website, or both?
Sure. Website is wellmedhealthcare.com/Dr. Wright, or you can call our toll-free number, 833-925-0422.
And is the word doctor DR, or is it spelled out?
It's DR. Good question. Yeah, DRRIGHT.
Excellent.
Very good. Doctor, have a good Thanksgiving. Thank you for what you do and for being on the show with us today.
Well, thank you, guys.
All right, we'll be right back.
America's built and based on liberties and freedoms. Liberty HealthShare brings that to healthcare. The liberty of choosing your own doctor. The liberty of choosing your own hospital. Liberty HealthShare makes healthcare affordable to millions of Americans. Light your liberty, starting at $199 for a single, $399 for a couple. And no matter how big the family, only $529. That's $529 for the entire family. To find out how you can save, go to lightyourliberty.com. That's lightyourliberty.com.
Hello, gorgeous.
Hi, this is Becky at Hello Gorgeous Salon. It's time to get that new look started. Let's get rid of those sun-damaged ends and faded out color and get into something rich and vibrant. Humidity is not your hair's friend. It causes your hair to capture moisture and leaves